Thank you. Good morning, everyone. Thank you for joining us today, and thank you for the important work that you do. This is Jessica Quinn. I'm the Comprehensive Cancer Control Program Manager in DHSS at the state of Alaska, and this is...
Hi, this is Remick. I work in breast and cervical cancer early detection for the Ladies First program, and we are also with the Department of Health and Social Services of the state of Alaska, and we're really happy to be with you all this morning.
So just a disclaimer, both of our programs are funded by the CDC, and today's presentation is a reflection of our work and not necessarily the official views of the CDC. So just a general overview of what we're going to cover today. Since October is Breast Cancer Awareness Month, we wanted to take this opportunity to share what we know about breast cancer in Alaska and in the abilities community. And we're also going to touch on the race and at the national level as well. Then we'll talk about things that you can do to prevent breast cancer for yourselves and your clients. We'll talk about breast cancer detection or screening, and then share some resources that can help in the work that you do.
Okay, this is Kara. I just want to jump in real quick. Sorry to interrupt. A couple of us are saying they can't hear, not everybody, but I just want to make a quick audio check. Can most of us hear? Raise the hand if you can. Okay, most of us can hear. It does happen sometimes. I know that if you can't hear me right now, it doesn't make sense, but if it happens, oftentimes the easiest thing to do is click out of the webinar and go back to your same link and then come back in, or try alternate audio, which would be via phone or try the phone instead. But everybody looks like they can hear, and I'll just give a quick example. Folks say I can hear, just not very loud. So turn your audio up on your machine, like your volume up, and then maybe if you all could be closer to your phone and just speak up, it would be great. Okay.
Sure,
Does that make sense? Okay, awesome. All right, go for it. You're good. Everyone can hear now.
Great.
Thank you.
Okay, great.
Go ahead.
Okay, so almost everyone knows someone who's been affected by cancer, by breast cancer specifically. It's the most common cancer in American women, and national estimates are that 1 in 8 women will be diagnosed with breast cancer in her lifetime. And the biggest risk factor for breast cancer is age. So your risk increases the older you get. So many people want to know how breast cancer rates in Alaska compare to the rest of the United States. So these maps show all of the states. I moved Alaska up to where it should be and the correct size. And as you can see in the blue map, Alaska ranks lower than most states in the number of new cases we get in a year. It's right around 114 women per 100,000 in our state will be diagnosed with breast cancer. And then the orange map shows deaths due to breast cancer. Again, we're just barely below the national average here, and we experience about just under 20 deaths from breast cancer per 100,000 women in our state in a given year. So if we look at only Alaska, we can see that there are higher rates of new breast cancers and deaths from breast cancer, more in the interior regions of the state. In these maps, they show up as a darker green. So we definitely see some regional variation there. I'm not sure if our attendees are calling in from all over the state or just Anchorage, but usually we speak to audiences from all over, so they like to see what's going on in their specific area.
This is Kara. Yes, we serve statewide. If you want to go ahead and type in for our presenters which areas you serve, that would be very cool. Go ahead.
Thank you. We're just going through the questions. We see Anchorage, Matsu, Southeast, Eagle River. Cool.
Okay.
Yeah.
Great.
Very cool. Thank you. Okay. And we can't really see like all the questions at once, so we're definitely receiving your questions, and we'll just make sure that we address them at the end. So looking at data specifically within the abilities community, we don't have it specifically for breast cancer, but for all cancers, among Alaskans surveyed, about 6 in every 100 people who said they had no disability reported being diagnosed with cancer in their lifetime. And that number goes up to 8 in 100 Alaskans who do experience a disability. So basically 6% of people who don't have a disability will have cancer in their lifetime, and 8% of people who also have a disability. And so as you probably all know, there could be many reasons why we see more cancer in the abilities community. It's not a huge amount more, but there could be lots of different reasons why we see that. Sometimes it's harder to access cancer screenings. Many cancer screenings are actually preventative. You can catch it before it becomes cancer. But people who experience disabilities may also miss out on some of the cancer protective lifestyle factors. So now we'll start talking about those under prevention. So these are some lifestyle habits that women who that work to lower their chances of getting breast cancer. So regular exercise, having a healthy weight, not smoking, and getting enough sleep have all been shown to lower women's risk of breast cancer. However, the data shows that Alaskans who experience at least one disability are more likely to be physically inactive, overweight, or obese, to smoke, and to get less than 7 hours of sleep at night. So they're already at higher risk for cancer because they're less likely to be practicing those healthy lifestyle habits. So it's important that as caregivers, you try to encourage and support a healthy lifestyle as much as possible among your clients, which I'm sure you already know and do. It's important. We try to encourage folks to tap into community resources like the Special Olympics to help your clients find ways to be physically active and maintain a healthy weight. Contact the Alaska Quit line for free tobacco cessation counseling, and communicate with their primary care providers about any sleep issues that may be happening. And these are some resources here. We put the links in there so that when you get the PDF of the slides, you can go ahead and go in there, but you're hopefully familiar with these services. The Special Olympics of Alaska just started a Healthy Communities program, where it's kind of like a health fair where they offer health screenings and other support services to have healthy lifestyles for the whole abilities community. So now I will pass it on to Anne, and she can talk with you about detection.
Right. Aside from prevention, early detection of breast cancer through screening mammograms is the best way to lower a woman's chance of dying from breast cancer. So we just talked about how people experiencing a disability are less likely to participate in cancer prevention activities. And going back to the data, we see that Alaska women experiencing a disability are also less likely to participate in a potentially life-saving breast cancer screening, which most typically is a mammogram. So the 71% of Alaskan women with no disability get screening mammograms, and 56% of women who experience at least one disability do get their screening mammograms. So there is a big difference between those two groups right now. So my call to action is really, please encourage your patients to talk to their healthcare providers about what breast cancer screening they need provider will want to know about risk factors and family history, and so that's something you can talk to them about beforehand. You know, some examples of risk factors, and this is not the whole list, but it could be like the BRCA gene mutation, which I think a lot of people have heard of, or first-degree relative, parent, sibling, or child who have had breast cancer early in life when they're younger. And then if your client has had a history of radiation treatment to their chest area before the age of 30, those are some things that can raise somebody's risk of breast cancer. But your client's provider can provide a more complete risk assessment for them so that they can have an idea of what they need to do. But please keep in mind that the biggest risk factor for breast cancer is getting older. So all your clients need to get mammograms. You know, talk to their provider when they're 40 to 49 years old, but starting at 50, it's really important to be getting a screening mammogram every 2 years. I lost my place. So the women experiencing disabilities may encounter multiple challenges to screening, including healthcare access, physical access issues, lack of transportation, and confusion about breast cancer screening, resulting in a lack of interest or urgency or even fear of breast cancer screening. But again, I'm wanting to reinforce that it is really important to find breast cancer early. The chances of surviving cancer, if it's found early, are really, really high. And here's a nice graphic that we like to share that really gives, I think, an easy to understand idea of, oh, okay, so if we get routine mammograms, the average size of the lump that they're going to find is going to be the size of a blueberry. But if nothing is done and you just happen to notice something, it could be the size of a strawberry by then. And so then the invasiveness of the treatment that's going to be needed is going to be so much greater. So it's just another way, I think, if you want to use something like this to talk to your clients, just show like, oh, okay, this is why it's really important, because we can catch it when it's small. So hopefully we've made the case for breast cancer prevention and screening. Jess provided some resources for being healthy, which can reduce the risk of developing breast cancer. And I'm sure that within your profession, you are probably aware of many more resources. I would like to talk a few minutes more about the Ladies First program as a resource for cancer detection or screening. So the Ladies First program is one of 5 programs funded by the Centers for Disease Control across Alaska, and we pay for breast and cervical cancer screening. We don't provide it, but we do pay for it. My program covers the entire state. The other programs are through tribal health systems. So for example, we call them our partner grantees. We have Search in Southeast Alaska, South Central Foundation for the beneficiaries in the South Central part of the state, Arctic Slope Native Association for the far north, and the Yukon-Kuskokwim Health Corporation for the southwest. So depending on where your clients live, they may be able to access services through any of these programs. The main difference is if the patient is a tribal health beneficiary or not. So how does our program work? I guess the first thing to talk about is what we don't cover, because there's a lot of questions about that a lot. We do not pay for birth control or general blood work or the diagnosis and treatment of sexually transmitted infections. And it's really focused on breast and cervical cancer screening. So, and one of the gaps that we've discovered is that Medicaid does not cover all the costs related to breast and cervical screening. So that's where our program can come in and step in and help with the cost of those screenings. We contract with about 150 different healthcare providers across the state. And I am always happy to share a list of our contracted providers in your region. So at the end of this slideshow, Jess and I will both have our contact information. And so please feel free to contact me if you are interested in finding out what providers work with Ladies First in your area. So some other benefits from the Ladies First program. If a patient is diagnosed with breast or cervical cancer, the Ladies First program can refer the patient into breast and cervical Medicaid through a special agreement we have with Medicaid. And then also before diagnosis, if your client has a screening mammogram, the results come back, oh, there's something we need to look at more carefully, and they need some diagnostic workup, and they live out in rural Alaska, our program can help pay for their travel costs to travel into Anchorage or another hub community to get more specialized screenings or more specialized testing done to see what's going on. And that's something that our program does directly. So you would need to coordinate with my team, and then we can help purchase airline tickets and hotels and get somebody where they need to go to get the further testing that they need. So who can qualify for Ladies First services? It's pretty open. We try to have a very generous income guideline for people who qualify. The one prohibition is if a patient has Medicare Part B, they are not qualified. But again, the income guidelines are pretty generous. For example, a family of 4 could make up to $78,000 per year in combined income and still qualify for our program. And one of our goals is to support not only patients at the very lowest income brackets, but also people with insurance that does not cover breast and cervical cancer screening services they need, especially for those diagnostic testing that people might need to have further on. So we really think, I like to think of our program as like the statewide safety net for this particular type of screening and detection. So how to enroll in Ladies First? Again, we're trying to make it really easy. Most of our contracted providers will have a paper enrollment form that a patient can fill out at check-in. We also have a 1-800 number that people can enroll over the phone. And so we don't require a tax return. We don't require, a social security number. They talk to our team on the phone, tell us what their income is, tell us, kind of their situation, and then we can immediately enroll them in the program. We try to have as few barriers as we can to enrolling. If your patient does not speak English, the staff who answer our 1-800 number are able to connect with a translator over the phone, so that is also not a barrier. If a patient is already seeing a Ladies First contracted provider, she very well may get a packet form with her paperwork at check-in. Most of our providers are very familiar with the program and can also answer questions about it. Once a patient is enrolled, Ladies First will send a packet of information in the mail about the program. There'll be a little kind of detachable card from the welcome letter that you can put in your wallet, so it shows that you're enrolled in the program. The enrollment needs to be renewed every year. So the little card will also have like the date of when the enrollment expires, and then the welcome packet will also include a list of the screening providers in the area where the patient lives. So one of the resources that actually, when Jeff and I worked together in this program, one of the resources that we developed is what we call the breast care booklet. And the intention of it is for it to be a really accessible, easy to read, lots of pictures, clear language guide to helping people understand what they need to do to take care of their breasts and take care of their health. It is based on a booklet created in the United Kingdom, and we worked with a local photographer and local models to really make this for Alaskan by Alaskans. But the intention is for it to really have a very easy to understand guide to taking care of yourself. And so this screen on the left side, we have 2 versions of the booklet, I guess I should clarify. One version is for clients and the other one is for caregivers, such as yourself. So what you're seeing on the screen is on the left side, it is really the step-by-step of getting to know your breasts and being breast aware. On the right side is the view from the caregiver booklet that is really giving some more detailed information on what you can share with your clients on how they can understand, okay, this is why this is important, this is what I need to look for, and to give you a little bit more information. And so this is another kind of, the left side is the client booklet and the right side is the caregiver booklet. So again, you'll see that the client booklet is really, it's more pictures and not a lot of text. And then on the right side, it's giving the caregivers more detailed information. And we've been sharing this booklet for about 6 months to almost a year. And so we have an outreach manager who goes out to like special health fairs. She's been at a couple of different events at the Special Olympics, and so we've been sharing this booklet pretty widely. And so I don't know if any of you have seen it already, but we have paper copies of it that we are more than happy to put in the mail to anybody who's interested in having them. And so then here's another resource, and this is, remember when we were talking about the importance of talking about family history with your client's healthcare provider, so that they can see what kind of breast cancer screening they need. This record keeper is a tool you can use to help your client have their history ready to share with their provider. So this is something that you can complete with your client or their family and then keep it with their other health records. And this is the inside view of that, where things would be written down. And Jess, do you want to talk any more about that?
Yeah, it just gives an opportunity to record not only the client, or use it for yourself as well. I mean, everyone really should have one of these completed. You can kind of record your health conditions in your immediate family, but also it makes an opportunity for you to go to perhaps your parents or your client's parents and find out what else is in the family tree that probably doesn't get talked about a lot. November is Family Health History Month, and Thanksgiving is Family Health History Day, with the idea that around the holidays is a good opportunity when you're gathering with your family to just make sure that everyone is aware of your family health history, so that if there are any issues, patterns, or things of concern that might be helpful for providers to be aware of. Just recording it down in something like this and sharing it could be potentially life-saving. And so this little document is available on the link there, and we can also, if you email me, my email will be at the end, I'm happy to send you a copy.
Okay, so again, thank you so much for joining us today, and I'll just do a recap of what we've discussed. We've talked about the things a person can do to lower their risk of cancer. We've talked about the importance of screening to find cancer early when it's more treatable. We've also talked about resources available. Ladies First can pay for screening and diagnostic services. The breast care booklet is available as a tool to talk with your clients about breast care. And the family history record keeper can help inform and guide their care. So please contact either of us with any questions. We are always happy to help. And now I think we will try to scroll through the questions bar and see about if we've forgotten to cover anything. So who do we email to ask for resources is a question, and me or Jess?
Yeah, and we work together all the time. We're just separated by a couple of floors in the same building. So if one of us doesn't have it, we always direct them to the other one. So.
Yeah. Okay. And sorry, Kara, is there a way to make the question section bigger?
Yeah, if you grab the corner of it, like the lower right hand corner, and just drag it. just click and hold and drag down, you'll see it get bigger. Lower right-hand corner of the box. If it doesn't work, I can read them out.
There we go.
You see
I
it?
needed Jess to do it.
Mm,
Okay.
there's a few. If you scroll up, especially,
Yep.
you see them.
Yep.
Okay. Oh boy. So there's easier said than done, right?
That's okay.
I like
Scroll through the. I can't get to your mouse. Just scroll down in this little box.
this one. This one.
Yeah.
Okay.
Let's
Easier said than done, right? But yes, encourage is nice. Most insurance. We're having some problems with
reading the whole question.
reading the whole question.
Maybe just drag it down and we can read it as you're holding it. Drag it down like we were before and make the box bigger and just don't let go. Oh, I don't know. It's nice. Most insurances cover this as a preventive measure now. In the past, they didn't, even if under 40. So it's a nice improvement on insurance coverage. Yep, good point.
Yeah, most insurance covers the screening mammogram, and then where we've seen people get into financial issues is when it's a diagnostic, then their copay is kicking in, then their deductible is kicking in. So yes, that's a good point. I have several individuals who refuse to do mammograms. Is there any advice making them more comfortable or receptive to these screenings, or what information in the breast care booklet? I mean, hopefully a tool like the breast care booklet can help demystify a mammogram for somebody. One thing that this program did probably about 5 years ago is, and this is previous to me working in this program, but one of our staff worked with Hope, and they put together basically a field trip to Providence Imaging Center so that any clients that were interested could just go and see what it was like and look at the mammogram machine, not to go get a mammogram, but just to go do a field trip to see what it was like. We would be happy to help organize something like that if there is interest. We're based in Anchorage, so we would be hands-on helping with that, but we can also work with some of our partners around the state if there is interest in doing something like a field trip to help demystify the process. I would like to know about breast cancer buses during October for perhaps free screenings, if there's a schedule. Oh, like the mobile mammography units. The mobile mammography units, there are two in the state. There's Providence Imaging Center has one that mostly goes around South Central and Kenai. And then Breast Cancer Detection Center in Fairbanks. They go pretty much all over the road system, and then they put the mobile mammography unit on the ferry in Southeast Alaska and go to a lot of those communities as well. The schedules vary on that. We try to keep an eye on them.
I think both places generally have the most recent information available on their website.
Yeah.
Yeah. So it'd be Providence Imaging Center or Breast Cancer Detection Center is the one located in Fairbanks, but they also travel around. Mm-hmm. And generally the free screening that they offer, it's usually billed to insurance, or if it's for women who don't have insurance or whatever, they're actually partnering with Ladies First, and that's how it's being covered. They're a strong partner of the Ladies First program. Mm-hmm.
This is Kara. I think that you can see the most recent questions real easy, but there were some earlier ones. And do you mind if I just read them out, and then we'll get them done?
Oh, we can go up there. We were just getting at the bottom.
Gotcha.
Sure. That's great. Go for it.
Some came in like about 10:05. If you look at the times, then you could just go back and, yeah, you got it. You're good.
Okay, we'll start at the beginning. Oh, that's where, oh wait.
All right, we we have a lot of good mornings.
Very friendly group.
What is the easiest symptom of breast cancer to identify for individuals with IDD?
Well, by the time you have a symptom of breast cancer, it's probably pretty progressed. So that's why we really promote screening. I think we showed in that little image how large it has to be before you feel a lump. And other common symptoms of breast cancer would be like nipple discharge and things like that that would probably be pretty easily overlooked. So it's really not something that like should be done, that should be dependent on being done at home. When, you know, we say like be familiar with your breast, like you should know your body and like have dedicated time to like check yourself out regularly, but that is by no means a substitute for breast cancer screening.
Okay, and then the statistical differences in diagnosis between communities.
Oh, it's not statistically different.
Okay.
That was where there was a difference, the 6% versus 8% for cancer. Sorry, the question was, what are the statistical differences in diagnosis between communities, ID and non? And that was where I showed the two groups of people. One was 6% of people who have not had a disability have also reported having cancer. 8% of people who have had a disability have also had cancer. That difference is not statistical because it's such a small number of our population. It's really hard to achieve statistical significance, but it's still an important indicator to keep an eye on because this is, I mean, we're all aware of the barriers that this community faces. So I don't think that it's practically insignificant, if that makes sense.
All right, we're going to scroll through some more questions.
I want to know, I'm curious how treatment and services are tailored to people with disabilities. I know that there are some centers who specifically assure that they're like wheelchair accessible. We also know of a couple of imaging centers who took a special training last year that we were promoting on being, it was like responsive practice. It was just kind of being aware of unique needs of certain clients, including those with who are experiencing disabilities. So I think it's really, unfortunately, it probably falls on caregivers like yourself to kind of do some pre-work and contact a place that you're thinking about going and seeing, like, you know, if they have special accommodations or how they generally serve clients like this. And that kind of ties also into what Anne was suggesting about the field trip. I think it would be really great to have like an organized event. But I think a lot of these, I mean, the imaging centers that I've worked with, I think they would be really receptive to having someone come in ahead of their visit, just like a week before, and have no pressure situation, and just like orient themselves to what to expect. And then like schedule the mammogram for a week after that. I think in general, people are really open to that.
So there's another question about resources for men, because men can also get breast cancer. The Ladies First program is geared to women. So we cannot pay for screening for men. I know that the YWCA has some funds to help pay for screening mammograms if a man is having symptoms. The screening guidelines for men, really, there aren't any.
Yeah, there are no current routine recommended screening for men, but there is definite, men can have the BRCA mutation if they have a strong family history. I mean, there's definitely a risk there, and that's why that documentation of family history and just keeping that at the forefront of the conversation with the provider, just so that they're really attuned to that as a risk. Men could possibly consider genetic counseling and then maybe genetic testing, but that's kind of outside the realm of what specifically Ladies First can offer.
Right. Yep, and I think the next question is also related to.
Yeah, we generally get questions about men with breast cancer. It is very rare.
Okay, and then we have, I think we talked about the
Awesome.
Okay. Would we email for resources and then reducing mammograms?
Love all the questions. Thank you, everyone.
Yeah, this is great. You said there are more detections of breast cancer in the abilities community. Is there a way to know if there are more or less deaths related to breast cancer in the two communities?
Unfortunately, there is not. Just with the general, with public health surveillance, we only have limited data sources. And the survey that asks about abilities does not ask about breast cancer and has no way of documenting death. And then the data that we have on breast cancer deaths, which comes from the Alaska Cancer Registry, does not collect data on abilities. So I think there's definitely some opportunities there where we could start asking similar, like we need to ask more questions in the cancer registry and start collecting that information so that we can really identify if these disparities persist in the cancer deaths as well. It's a good question.
Do certain races and ethnicities have an increased risk for breast cancer? African American women have a higher rate of breast cancer for sure. I'm trying to think.
The Ashkenazi Jewish population has an extremely high risk. Those are generally they're generally carriers of the BRCA mutation. And again, this is all information that a primary care provider would factor into determining a patient's risk if she should start screening earlier or consider genetic counseling.
Mm-hmm. So, are there any infrared imaging options in Alaska for breast cancer screening? Infrared imaging has not been proven to be like Ladies First program does not pay for infrared imaging because screening mammography has been shown to be much more effective. So our recommendation is going to be to have your clients go to get a screening mammogram as their screening option.
Yeah, it's really the best tool for that. I think science continues to explore alternatives, but I think the medical groups that develop recommendations, they kind of take all of the data that's out there and really help us do the work of figuring out risk versus benefits and the most effective type of screening. And so I think it's important to follow where the science is pointing.
In general, do breast cancer tumors grow slower the older a woman is?
That's probably outside of our.
Yeah.
We're not oncologists.
I think
it probably just depends on the type of cancer.
Right. I think it's known that breast cancer in younger women tends to be more aggressive. Mm-hmm. But I don't know the answer to do the tumors grow slower the older a woman is. There's many different types of breast cancer. So I agree with Jess that it really is going to depend on the type of breast cancer. Mm-hmm. And I think that was the last question. Mm-hmm. Kara, did we miss any that you can tell?
I think you got them. Oh, here's a comment.
Yep.
When I was a hospice social worker, when we had very elderly women with breast cancer, someone else, usually something else.
Yeah, they say, cancer is one of those things, I think generally, it's dark, but eventually everyone will die of cancer. You live long enough and you will get cancer. For men,
and the screening recommendations stop at 75.
Right. Yeah. For men, it's generally prostate cancer. For women, it's breast cancer. But yeah, the screening recommendations do consider stopping at 74. I think the benefit of screening is usually if the patient is considered going to live another 15 years, I think is what it is. Mm-hmm. So at that point, and that again is just another conversation that should be had with the care provider. We've definitely heard about patients who, they're super fit 90-year-old and she wants to keep having her mammogram. She can. Unfortunately, Ladies First can't pay for it, but it really should be a shared decision between the client and their provider. Lung cancer much more prevalent in women than breast cancer. So breast cancer is the most commonly diagnosed cancer in women, but lung cancer is the most fatal. The more women die of lung cancer. The screening for lung cancer just came out within the last several years, so it hasn't quite been picked up yet, and still not covered by all types of insurance. And so unfortunately, lung cancer is usually diagnosed when the survival is very, very low. So it does have a very high mortality rate. So that goes back to the cancer prevention of don't smoke or stop if you do. Mm-hmm. Good question.
Yeah, these are really good questions. So this is Kara again. Last call for questions here. I know you got them all. You got all the texted ones in. Any others on your mind for our presenters? We'll give
yeah,
a few.
We actually had some questions for you guys. I mean, it's
cool.
a rare opportunity that we get to reach an audience like this. I think both of our programs are always trying to find ways to reach the abilities community. I mean, because you see these disparities where the screening is lower, possibly the cancer rates are higher. It's definitely an underserved community in a lot of ways. So we would love to find out from you, like what is the best way to reach this group? What message should we be promoting?
Where should we be going?
Yeah, like we would love, you guys are the subject matter experts on that, and we would love any input on that. And if you don't have the answer right now in the chat box, please email us. We would love to have more partners that we could work with on this.
Good question. What would you say from your experience that our presenters and their unit could do to advance this to people we serve?
What could, oh no, okay.
Oh great, we're seeing some.
Wow.
Oh,
wow. Great. We've got lots of people typing in. This is awesome.
So this is a great way. I agree. This is a really great venue. We just learned about it, and we're really grateful that we could come talk to you guys. Mm-hmm. Through providers. Yeah, these are the people our clients are most comfortable with, and they'll be receptive to listen to them. That's good. Yeah, we've been kind of kicking around the idea of turning the breast care booklets into like a flip chart that could be kind of walked through in the doctor's office as well, or even in the client's home with their caregivers. Again, to kind of just make it not so scary.
So I'm reading the comment of, since it's Breast Cancer Awareness Month, why not tie it into community events by including individuals with special needs? It's a fantastic idea. It's really interesting this year. There's not a lot of events around Breast Cancer Awareness Month, but that's, I think maybe that's really just an Anchorage. I think there are things going on in other communities. That's a really great idea. Yeah. Providers need to be better informed. Yep. The Ladies First program, we do work with our contracted providers to make sure that they have the latest information and are able to have this on their radar, for sure. So we have one other question that we would love to, wait a minute, the pamphlet.
Oh, a couple more just came in. Sorry.
A pamphlet drop at the ARC Hope. Yes, we have been sharing our breast care booklet with the ARC and Hope and other organizations like that for sure. And then would DPA be able to distribute information when it's time for their medical review?
Medicaid review.
Medicaid review.
I don't know what that is, but that sounds great.
we're totally open to that. So Melanie, if you want to email me and Jess a little bit more about that, we would love to explore that with you.
Yep. Booklet to each assisted living home.
Mm-hmm.
Nice to have on hand. Yeah.
Yeah, we've shared the booklets with some of the more, I guess, private nursing companies. So, like, I think Trinian and some other organizations, our outreach manager connected with them at, I think, a Special Olympics event, health event. So we've been trying to, like, get these out as much as we can. Yes, absolutely. Okay. So then, okay, I think that's it.
Yep.
Unless there's any other questions.
All right. Well, you can always email us. Again, we love talking to people who are, in the quote unquote front lines and helping people in the communities. And if you have any ideas on how we can better help, or you just feel like you could help pass out some pamphlets as well or booklets, please don't hesitate to reach out to us.